An 8-year-old girl laid to rest, not from cancer, not from an accident, but from measles. Yes, measles, a disease we were supposed to have defeated 25 years ago. And at that funeral, standing solemnly among grieving families, was Health Secretary Robert F. Kennedy, Jr. But here's where it gets complicated, because some blame him for her death. Welcome to a story about a deadly outbreak, a controversial health leader, and the battle between science and misinformation. Stay with me, because this one's going to leave you thinking. An avoidable death, Lubbock, Texas. An 8-year-old girl dies from measles pulmonary failure, one of the most tragic and preventable outcomes of this disease. Doctors confirmed she had no underlying conditions. Her only vulnerability? She was unvaccinated. This was the second confirmed measles death in the U.S. in over a decade. And here's the kicker. Measles is completely preventable. According to the CDC, 2 doses of the MMR vaccine are 97% effective at preventing infection. But in Texas, vaccine exemption rates have soared from 7.5% in 2013 to over 17.5% in some counties. That's not a coincidence. That's a crisis. Kennedy's controversial role. Health Secretary Robert F. Kennedy, Jr. has a long, controversial history with vaccines. He was once a leading figure in children's health defense, an anti-vaccine group that has spread misinformation about vaccine safety for years. Now, as the nation's top health official, he's offering only muted support for the MMR vaccine and instead focusing on alternative treatments like cod liver oil and vitamin A. While speaking at the funeral, Kennedy said, "The most effective way to prevent the spread of measles is the MMR vaccine." But for many, that message came too little, too late. Doctors say his emphasis on unproven treatments has caused parents to delay real medical care, leading to dangerous vitamin A overdoses and preventable deaths. Dr. Peter Marks, former top vaccine regulator at the FDA, called the child's death a needless tragedy. The outbreak that keeps growing. This isn't just about one child. This is a growing national emergency. Since late January, West Texas alone has seen 1. 480 measles cases. 2. 56 hospitalizations. 3. Outbreaks spreading to New Mexico, 54 cases, and Oklahoma, 10 cases. If this continues, the U.S. could lose its measles elimination status, which it earned in 2000. And here's the scariest part. Measles isn't just a rash. It can cause 1. Pneumonia. 2. Brain swelling. 3. Blindness. 4. Intellectual disabilities. 5. Death in 1 to 2 out of every 1,000 infected children. The virus can live in the air for up to 2 hours after a sick person leaves a room. If you're unvaccinated, exposure is almost a guarantee of infection. Disinformation's deadly impact. Here's where the real danger lies. Disinformation spreads faster than any virus. Shortly after the girl's death, anti-vaccine figures claimed it was a hospital error, not measles, that killed her. Some even accused doctors of medical mismanagement without evidence. This has enraged the medical community. Dr. Michael Osterholm, a top epidemiologist, said, "This sits squarely on the back of anti-vaccine voices that continue to spread disinformation. The more people believe these false claims, the more they refuse vaccines, and the more the virus thrives." What needs to happen now? Here's what the experts are demanding, and what we all should be pushing for. Unequivocal support for MMR vaccination from top health officials, immediate public education campaigns in outbreak zones, rebuilding trust in science and medicine, fact-based messaging, especially on platforms like TikTok where misinformation runs wild. And let's be clear, vitamin A is not a cure. Yes, it may reduce complications in sick children, but it cannot prevent measles, and it doesn't replace the vaccine. If we want to stop this outbreak and prevent future ones, we need leadership that listens to science, not fringe theories. From tragedy to wake-up call. This girl's death is more than a headline. It's a warning. It's a call to action. And it's a tragic reminder of what happens when science is ignored and fear wins over facts. Let's not let her die in vain. If you're a parent, talk to your pediatrician. If you're unsure of your vaccine status, get checked. And if you care about public health, speak up, even when it's uncomfortable. Measles shouldn't be killing kids in 2025. We have the tools. We have the knowledge. All we need now is the will. If this story moved you, like, share, and drop your thoughts in the comments. Follow for more deep dives into the biggest health stories shaping our world. Let's fight misinformation together, one post at a time. Vaccines work. Measles. Outbreak. Public health. FKJR. MMR. Health crisis. TikTok news. Speak up. Science. Not silence. Total word count. Approx. 100 words. Ready for narration, post captions, and text overlays on your TikTok channel. Let me know if you want this turned into a video script with on-screen text and timing.